Welcome to the podcast. My name is Dr. Nora Gajraj. Let's talk about the health benefits and risks of coffee, more than just a morning boost. First, there's a reduced risk of neurodegenerative diseases. Parkinson's disease studies consistently suggest that coffee consumption may decrease the incidence of Parkinson's disease. Alzheimer's disease. Chronic coffee consumption, particularly moderate intake, 2 to 3 cups daily, is associated with potential protection against Alzheimer's progression and a lower risk of related neurological disorders. Bioactive compounds like caffeine, trigonylene, chlorogenic acid, and caffeic acid are believed to contribute to these neuroprotective effects. Cardiovascular health and lower mortality risk. Lower all-cause mortality. Habitual coffee consumption is linked to a lower risk of death from all causes. Cardiovascular protection. Coffee consumption may lower the risk of coronary vascular death, coronary heart disease, congestive heart failure, and stroke. Post-myocardial infarction or heart attack. Drinking coffee habitually after an acute myocardial infarction has been associated with a reduced risk of mortality. Positive effects on cardiovascular risk factors. Coffee may positively influence several cardiovascular risk factors. Type 2 diabetes, potential for improved management or reduced risk. Depression may have a positive impact. Obesity, potential for beneficial effects. Hypertension, recent meta-analyses suggest an inverse association between coffee consumption and hypertension risk, with higher intake potentially linked to a reduction in risk, though this can vary by study characteristics. Other notable health benefits. Improved asthma control. Coffee may be associated with improved asthma control. Reduced liver disease risk. Coffee consumption may lower the risk of liver disease. Reduced cancer risk. Highly suggestive evidence for an inverse association between coffee intake and the risk of liver cancer and endometrial cancer. Further research is ongoing for other cancer sites. Important considerations, potential risks, fracture risk in women. Coffee may increase the risk of fractures in women due to increased calcium excretion, potentially leading to lower bone density over time. Pregnancy risks. Coffee consumption during pregnancy may increase the risk of low birth weight and preterm labor. Blood pressure. While some studies show an inverse relationship with hypertension risk, other reviews highlight that dietary caffeine can increase blood pressure, potentially contributing to cardiovascular mortality and morbidity, especially at higher doses. Key points for consumption. Moderate consumption is key. The largest health benefits are typically associated with moderate coffee consumption, generally defined as 1 to 5 cups per day. Observational studies. Most research on coffee's health effects comes from observational studies. More randomized controlled trials are needed to confirm causality. Balance risks and benefits. It is crucial to weigh the potential benefits against the potential risks, especially for individuals sensitive to caffeine or those with specific health conditions. Consult with a healthcare professional if you have any concerns. Conclusion. Coffee offers a range of potential health benefits, from protecting against neurodegenerative diseases and improving cardiovascular health to reducing the risk of certain cancers and liver disease. However, awareness of potential risks, particularly those related to caffeine sensitivity, fracture risk in women, and pregnancy, is essential. Enjoying coffee in moderation appears to be the most beneficial approach for most individuals, fostering a balance between its positive impacts and potential adverse effects. Well, thanks for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to the channel.